Is Mirabegron the ultimate Clenbuterol replacement that doesn't downregulate the beta-2 adrenergic receptors and still keeps fat loss going without the need for ketotifen or Benadryl, making you sleepy AF? Keep watching if you hate those crazy Clenbuterol cramps and having a resting heart rate of a hummingbird or cheetah. Mirabegron has none of that. It's just as potent for fat loss and better overall. Let's get into it. Vigorous Steve here. Let's discuss Mirabegron, also known under the brand name Mirabegron or Betamiga, and see how this compound compares to Clenbuterol or Salbutamol, also known as albuterol, for their off-label usage, fat loss, and anabolism potentially. As a quick comparison, Mirabegron is a beta-3 adrenergic receptor agonist that's prescribed in the treatment of an overactive bladder, allowing you to pee significantly less often because beta-3 adrenergic receptor stimulation on the smooth muscle tissue of the bladder allows it to relax, holding significantly more urine in the process, and this reduces the frequency of urination, especially at nighttime. So instead of having 3 or 4 pees over the night, you now have 2 pees, even though the amount of urine is basically double because you still pee the exact same amount over the night. At least you'll be able to sleep significantly longer in between sessions of nighttime urination. Clenbuterol is a beta-2 adrenergic receptor agonist that's prescribed in a select few countries in the treatment of asthma, as it's a very potent bronchodilator, making breathing a lot easier. And it's also used to improve feed efficiency in livestock, often in combination with the trembolone sandwich, and this already alludes to its potential for anabolism. And salbutamol, also known as albuterol, is another potent beta-2 adrenergic receptor agonist, has a very localized effect within the lungs, especially when inhaled. It's prescribed in the treatment of asthma worldwide, as it's a very potent bronchodilator. I've been using salbutamol since the age of 3 when I was diagnosed with asthma, 37 years ago. Mirabegron is solely available as an oral medication. Clenbuterol is available as an oral medication, but also found in injectable Helios formulations alongside yohimbine, and this is one of the few injectables that can actually spot reduce fat tissue at the site of administration, similar to glucagon injections. Salbutamol is available as an inhalant in dosages of 200 micrograms per serving, also available as oral medication, and can even be administered intravenously under special medical conditions. Oh, and before I forget, salbutamol is also a key ingredient in Super Shredder by Anabolics Anonymous, which is an injectable pre-workout alongside ATP, AMP, and carnitine, which is probably my favorite pre-workout to take in an injectable form alongside my Grill Modes Nitric. Now, while fat loss is not the primary indication of Mirabegron, Clenbuterol, or salbutamol, this is basically the sole reason why we take these kinds of beta-2 or beta-3 adrenergic receptor medications when it comes to our overall physique development. We're after the fat loss and reduction in nighttime peeing or peeing overall, or bronchodilation, improving overall endurance and stamina is a warm welcome side effect, even though that's the primary indication of these medications. So let's first discuss the medical applications for Mirabegron, also known as Mirabegron or Betamiga, and go over the commonly prescribed medical dosages. Again, Mirabegron medical applications are the treatment of overactive bladder with symptoms of urge, urinary incontinence, urgency, or urinary frequency, in which case the dosage is usually 25 to 50 milligrams once daily, usually upon waking because it has a very long half-life of 50 hours. But in particular conditions, the dose might be escalated upwards between 50 milligrams to 150 milligrams twice daily. So that's between 25 milligrams to 300 milligrams total over the day. And Mirabegron is occasionally combined with 5 milligrams solifenacin succinate, which is a muscarinic antagonist. Try pronouncing that. This is my 20th take. Mirabegron is also a mild cytochrome P450 2D6 inhibitor. This is very important to understand because Mirabegron might slow down the metabolism of certain medications that you're already taking. So this is the case with fluvoxamine, for example, a very potent cytochrome P453A4 inhibitor, and with Mirabegron that works on the CYP2D6 enzymes. So you really have to do your due diligence researching regarding drug interactions because that's not to be taken lightly. Now, of course, I already did the research for you, so you don't have to. Again, Mirabegron might be a mild cytochrome P450 2D6 inhibitor at the medical dosages between 25 milligrams to 50 milligrams daily. But when you start ramping the dosage upwards for the purpose of fat loss, let's say 100 milligrams to 150 milligrams daily, then this mild inhibition of the 2D6 enzymes might turn into a potent inhibition of the 2D6 enzymes. So I felt it was only fair to give you a comprehensive list of all of the drugs and medications that we might use in the fitness community that are metabolized by the cytochrome P450 2D6 enzymes. Antipsychotics like haloperidol, for example, the beta blockers carvedilol, metoprolol, nebivolol, propanolol, and other beta blockers. And keep in mind that nebivolol also activates the beta-3 adrenergic receptors, but we'll get into that a little bit later on. The calcium channel blockers diltiazem and nifedipine, lysergic acid diethylamide, better known as LSD. So if you're taking a microdose occasionally for mood management over the weekend, for example, this microdose might turn into a hero's dose. Now, actually, it will just turn into a slightly higher than a microdose by inhibiting the cytochrome P450 2D6 enzymes when combined with Mirabegron. Opioids, codeine, oxycodone, tramadol, etc. The selective serotonin reuptake inhibitors fluoxetine, fluvoxamine, and paroxetine, which all three are mild to potent cytochrome P450 2D6 inhibitors. So if you're combining any of these selective serotonin reuptake inhibitors with Mirabegron, you get a double whammy when it comes to the CYP2D6 enzyme inhibition. And then alongside 2D6, fluvoxamine is also a moderate cytochrome P450 3A4 inhibitor, preventing the breakdown of other medications, including anabolic androgenic steroids. So if you want to get more bang for your buck from anything that goes through 2D6 and 3A4 cytochrome P450 enzymes, feel free to combine Mirabegron with fluvoxamine. I've done it. And, well, you definitely get more mileage out of some of the compounds that you're taking. And the following stimulants are substrates for the 2D6 enzymes: amphetamines, methoxyamphetamines, dextromethamphetamines, and lisdexamphetamines, which are basically Adderall, Dexedrine, Vyvanse, etc. So if you're combining Mirabegron, which is already a stimulant to a certain extent, with a medically ADHD medication, Adderall, Dexedrine, Vyvanse, etc., well, it might be overstimulation, and I wouldn't recommend it. Tamoxifen is a substrate for the cytochrome P450 2D6 enzymes, as well as tricyclic antidepressants. So, caution is advised if you're going to take Mirabegron at higher dosages for fat loss, because some of these medications, and again, this is not all of them, but the substrates for the 2D6 enzymes and the 3A4 enzymes are listed down below in the description section. Do additional research, because you might get drug interactions, and the stuff that you're taking right now might be significantly more potent than before. Here are the commonly reported side effects when taking Mirabegron solo, so that's not in combination with beta blockers, LSD, or these stimulants like Adderall or Vyvanse or Dexedrine, right? This is commonly reported side effects of Mirabegron only at the clinically recommended dosages between 25 milligrams to 50 milligrams daily. Angioedema, elevated resting heart rate, tachycardia, elevated blood pressure, elevated basal body temperature, urinary retention, and at higher dosages, urinary tract infections, increased potency of the cytochrome P450 2D6 substrate medications, like I just mentioned, and even weight and body fat loss at a low dose of 25 milligrams to 50 milligrams daily. Imagine what kind of side effects you would get when you start escalating the dosage upwards. A little bit of health management is to be put in place. So with the precautions and the disclaimers and the warnings out of the way, let's look into the evidence-based unique characteristics of Mirabegron solely when it comes for its off-label purposes, fat loss. Right? There's a boatload of scientific publications performed on the medical treatments, the safety and efficacy data, the overall clinical trials. Interesting, but not applicable for this video. Let's just stick to what we're really interested in here. Mirabegron increases brown adipose tissue metabolic activity. It increases beige adipocytes, which is increased brown adipose tissue within subcutaneous white adipose tissue, which is actually similar to cold exposure and exercise, making Mirabegron an exercise mimetic as well as a cold exposure Mimetic. So now you don't have to exercise or go to the ice bath, even though a combination of an ice bath, exercise with Mirabegron, and yes, I've already done this, great for fat loss. Mirabegron increases resting energy expenditure and resting metabolic rate, another exercise mimetic effect. It's around 7% increase at the 50 milligram dose, between 11 to 15% at the 100 milligram to 150 milligram dose, and between 13 to 16% at the 200 milligram dose based on a single administration. The half-life is 50 hours, right? So with consecutive administrations or multiple administrations over the day, you would expect an increase in resting energy expenditure and resting metabolic rates far beyond what's documented here. And again, the citations are down below in case you want to read these studies by yourself. Mirabegron increases basal body temperature between 0.1 to 0.3 degrees Celsius, which is between 0.2 to 0.5 degrees Fahrenheit. I've noticed that my basal body temperature and my body temperature during the workout has increased substantially, but I'm also using SLU-PP332, which also increases basal body temperature and body temperature during the workouts, and then alongside all of the other lipolytic agents, like cardarine and, in combination with Clenbuterol, Salbutamol, which we'll get into a little bit later on, growth hormone, right, carnitine, which helps with fatty acid shuttling into the mitochondria. Body temperature will go up when you start stacking Mirabegron with a couple other fat loss aids for your fat loss journey. So make sure you bring a towel to the gym and shower more often. Mirabegron improves pancreatic beta cell function, resulting in better glucose management in the bloodstream. It reduces skeletal intramuscular triglycerides as a result of a beta-3 adrenergic receptor stimulation and increase in resting energy expenditure, but certainly during the workout, energy expenditure goes up, burning more fatty acids within skeletal muscle and from adipose tissue, obviously. Mirabegron increases type 1 muscle fibers, which enhances fatty acid oxidation and mitochondrial biogenesis, which also enhances the peroxisome proliferator activator receptor gamma coactivator 1A mRNA expression, and it might enhance a PPR gamma mediated effects of telmisartan and should go well with cardarine. So if you're taking Mirabegron, cardarine, and telmisartan with SLU-PP332 for mitochondrial biogenesis, I mean, that's a whoop-de-doo of fatty acid oxidation and increase type 1 muscle fibers, but SLU-PP332 also increases type 2A muscle fibers. So endurance, fatty acid oxidation, overall stamina, and body composition should definitely go up when you combine all of these together. Mirabegron improves exercise capacity, just like Clenbuterol and Salbutamol. It raises high-density lipoprotein, apolipoprotein A1 levels, so that's promising. Mirabegron reduces total cholesterol levels. It improves oral glucose tolerance tests by improving insulin sensitivity and overall glucose uptake in skeletal muscle, and it lowers hemoglobin A1C levels, but this is all coming from obesity, insulin resistance, and diabetes studies. So if you're already doing everything right, or eating right, or doing your daily fasted cardio, you're taking your ezetimibe to lower total cholesterol levels, you take some testosterone, and you manage your caloric intake, particularly carbohydrates, and you don't make those to growth hormone, multiple servings over the day, then I don't think you're going to notice any benefits regarding your total cholesterol levels or improvement of glucose tolerance or hemoglobin A1C levels. But again, my blood work will drop at the end of this month, and then let's see how much of an improvement I got from, taking 150 milligrams Mirabegron per day alongside everything else that I'm doing correctly. Mirabegron improves bile acid metabolism. Very good for overall excretion of metabolic waste products. Even though I couldn't find any clear scientific evidence that Mirabegron can actually improve metabolic parameters of the liver, again, blood work will determine that in the future. Mirabegron potentially improves bile acid flow and removes gallstones by increasing gallbladder size up to 35% at the 200 milligram per day dose. I haven't done any organ imaging on Mirabegron, but the last time I did organ imaging, my gallbladder was the exact same size, and I can't say that bile acid metabolism or stool has improved in any way, shape, or form, but the scientific evidence is there down below in case you're interested. Mirabegron might be a potential treatment of benign prostatic hyperplasia, as there's some overlap with overactive bladder syndrome. So if the prostate is larger, pushing against your bladder, and now you have to pee more often, if you can increase the size of your bladder and when you do pee, the urine flow is significantly increased, perhaps in combination with tamsulosin or anything else that might resolve a benign prostatic hyperplasia, then this could be a route that you need to look into if you suffer from this condition, right? Discuss this with your doctor if you have a BPH yourself. It might protect against heart failure, it might improve metabolic disorders, and unfortunately, Mirabegron has no established anabolic effects, unlike Clenbuterol and Salbutamol. But I couldn't find any clear scientific evidence where Mirabegron has actually been studied regarding its potential anabolic effects. Now, since it only works on a beta-3 adrenergic receptors, you would say that there's no anabolic effects because the anabolic effects are coming from the beta-2 adrenergic receptors, which is what Clenbuterol and Salbutamol is active on. Before we continue, I quickly want to highlight one study performed on healthy individuals. Many of the studies on Mirabegron have been performed on unhealthy individuals suffering either from an overactive bladder or obesity or insulin resistance, diabetes. That's not really what we're after. We're after the effects in healthy individuals. So this study is performed by Lowe et al., published on February 2019, not too old, titled Acute Metabolic and Cardiovascular Effects of Mirabegron in Healthy Individuals. In this study, they took 17 healthy volunteers aged between 18 to 35 years old, received either a single dose of 50 milligrams Mirabegron, 100 milligrams, 150 milligrams, or 200 milligrams once, with a 3 to 14 day washout in between escalating dosages. So you start at 50 milligrams, single dose, wait a couple days, 3 to 14 days, then the second dose of 100 milligrams, 150 milligrams, 200 milligrams, etc. During the study, the researchers kept track of their body weight, waist to hip ratio, blood pressure, body composition, and serum glucose and insulin levels. Energy expenditure peaked at 180 minutes after Mirabegron administration, where the highest resting energy expenditure was observed at the 100 milligram and 200 milligram dosages. Supraclavicular skin temperature, that's this area, mostly increased with the 50 and 150 milligram dosages, but the 200 milligram dosages kept skin temperature, again in this area, comparable to baseline, 180 minutes post-administration. Diastolic blood pressure increased only slightly with all dosages, so that's promising. Systolic blood pressure did increase after the 150 milligrams and 200 milligrams administrations, and resting heart rate also increased with all dosages, with the most significant increase seen at 150 milligrams and 200 milligrams administrations. Again, let's say 180 minutes post-administration in a single serving. So this is important to understand. Most of the problems regarding resting heart rate and blood pressure start to manifest at higher dosages in a single serving. This is not what is advised when it comes to fat loss. I would advise most people, if you go with Mirabegron, similar to Clenbuterol or Salbutamol, to split up your dosages. And again, Mirabegron and Clenbuterol have reasonably long half-lives, whereas Salbutamol has a reasonably short half-life. It would still be better to split up the dosage to minimize any potential negative side effects when it comes to blood pressure or an increase in resting heart rate. In this study, just like so many other single administration high-dose human studies, the researchers feel that higher dosages of Mirabegron are not suitable for daily administrations simply due to an increase in resting heart rate and overall blood pressure. And again, this is one of the reasons why I would recommend everybody to split up the dose. Now, personally, I've experimented with up to 150 milligrams Mirabegron per day in combination with telmisartan and doing daily fasted cardio and everything else that you need to do to keep your blood pressure and overall resting heart rate in range. My blood pressure stayed pretty much identical after adding in the Mirabegron, but my resting heart rate did increase by approximately 3 to 5 points at the maximum dose of 150 milligrams Mirabegron per day, spaced over 3 servings, 50 milligrams, before fasted cardio, before the workout, and before bed. Now, at the effective dose of Clenbuterol, let's say 80 micrograms to 120 micrograms daily, my resting heart rate would increase between 10 to 25 points. And that's the difference between Mirabegron and Clenbuterol. Mirabegron doesn't work on the heart, but Clenbuterol does significantly. And during the workout, it's a huge difference, right? My heart rate during the workout was very manageable. I didn't really notice a significant increase at the maximum dose of Mirabegron that I took. But at Clenbuterol from 20 micrograms onwards, my heart rate during the workouts is already sky fucking high. Imagine at 80 micrograms per day or 120 micrograms per day. It would be way too high. My rest periods would be twice as long because my heart rate would be so high and it'd take a very long time to come back down for another strenuous set. So when it comes to resting heart rate, from my personal experience and heart rate during the workouts, Mirabegron wins hands down. And while we're on the subject, how does Mirabegron compare to Clenbuterol and Salbutamol? Is it really superior when it comes to side effect-free fat loss through the beta-adrenergic receptors? Let's find out. I did all of the comparisons for you, so you don't have to. Regarding their clinical usage, Mirabegron is used in the treatment of overactive bladder syndrome. Besides being used as a veterinary medication, Clenbuterol is also used as a bronchodilator for asthma, chronic obstructive pulmonary disease, and other respiratory conditions. And Salbutamol is also used as a bronchodilator for asthma, bronchospasms, chronic obstructive pulmonary disease, and other respiratory conditions. For these clinical usages, the clinical dosages are as follows. Mirabegron is between 25 milligrams to 50 milligrams daily, but might be ramped up to 300 milligrams daily. Clenbuterol for humans is 20 micrograms to 80 micrograms daily in clinical settings. For Salbutamol, when inhaled, that's 100 micrograms to 200 micrograms every 4 to 6 hours, with a maximum dose over the day of 800 micrograms. Oral usage is 2 to 4 milligrams 3 to 4 times daily, maximum 8 milligrams total over the day. Intravenously, under medical conditions of hyperkalemia, for example, that's 250 micrograms to 500 micrograms as an initial bolus dose over a slow drip of 5 to 10 minutes, and then 5 micrograms to 20 micrograms per minute as a continuous IV infusion. Subcutaneous, 250 micrograms every 4 to 6 hours at an unknown maximum dosage over the day. And intramuscular administrations is clinically not recommended, even though that's something we do with Super Shredder pre-workouts in special conditions when we want to go to town on the weights, right? But that's not a medical condition. The half-life of Mirabegron is 50 hours. The half-life of Clenbuterol is between 36 to 48 hours. With Salbutamol, when inhaled, is 3.8 to 6 hours. Oral, 5 to 7.2 hours. Oral extended release, 9.3 hours. Intravenous, 5.5 to 6.9 hours. And with subcutaneous or intramuscular administrations, the half-life is unknown. So proceed with caution. The beta-adrenergic receptor activation of Mirabegron is solely on the beta-3s. Clenbuterol, that's beta-2 and beta-3s. And Salbutamol is beta-1 and beta-2s. But when Clenbuterol activates the beta-3s or Salbutamol activates the beta-1, that's only weak activity and only observed at higher dosages. Let's get into that because that's sometimes what we're after, especially with Clenbuterol. How much Clenbuterol do I need to take to get overlap into the beta-3 adrenergic receptors and get activation of brown adipose tissue and improve overall fat loss? From all of the scientific literature that I can find in healthy individuals or asthma patients, it seems that beyond 80 micrograms Clenbuterol onwards, the beta-2 adrenergic receptors are saturated and there's spillover into the beta-3 adrenergic receptors. And with Salbutamol, it only seems to activate the beta-1 adrenergic receptors, not the beta-3 adrenergic receptors, which would otherwise stimulate additional fat loss by activating brown adipose tissue. So you only get an increase in heart rate, which could also result in enhanced fat loss, but not through the pathway you're actually after in this context. When Salbutamol is inhaled beyond 800 micrograms to 1200 micrograms daily, spaced out over the day, or taken orally over 8 milligrams daily, this activates the beta-1 adrenergic receptors, increasing resting heart rate and heart rate during strenuous activity, but not the beta-3 adrenergic receptor. So in this context, if you want beta-1 or beta-3 adrenergic receptor spillover from beta-2 receptors at higher dosages, Clenbuterol wins. Yeah, hands down. And with that being said, if your body weight is a little bit higher than normal, which it probably is because you're into health and fitness, you're a bodybuilder or a fitness enthusiast or a strongman or powerlifter, you're probably way heavier than normal, then before you can expect beta-2 into beta-1 or beta-3 adrenergic receptor spillover from Clenbuterol or Salbutamol, you probably have to ramp up the dosages a little bit higher than I just mentioned as well, unless you want to combine Clenbuterol with Mirabegron or Salbutamol with Mirabegron. And then I would stick to these dosages because you get plenty of beta-3 adrenergic receptor activation from the Mirabegron at, let's say, 50 milligrams to 150 milligrams over the day. So I would limit it if you are crazy enough. I don't recommend this. I already tried this. We're going to discuss that a little bit later. If you're crazy enough to combine Clenbuterol with Mirabegron, please limit yourself to 80 micrograms Clenbuterol and, well, let's say up to 150 milligrams Mirabegron, or 8 milligrams Salbutamol and 150 milligrams Mirabegron. We'll get into this a little bit later on. Don't you worry. But to quickly summarize, at higher dosages beyond 80 micrograms Clenbuterol daily, it spills over into the beta-3 adrenergic receptors, ultimately relaxing the bladder. Some of you guys might have experienced this. From a certain dose of Clenbuterol onwards, you pee less. And when you do pee, it's a lot of pee. Right? So this is the spillover that occurs from the beta-2 into the beta-3, ultimately relaxing your bladder, allowing you to pee less, also resulting in a significant amount of fat loss through the beta-3 adrenergic receptors in adipose tissue. And some of you guys that experiment with salbutamol at higher dosages, let's say from 8 milligrams onwards, you might notice that your resting heart rate and your heart rate during the workout is significantly increased beyond what you would expect from salbutamol by itself, right? Because now you get beta-1 and beta-2 adrenergic receptor activation, and the heart rate goes up substantially, but probably not to the point that your heart rate goes up from a significant dose of Clenbuterol. So pick your poison, I would say. Oh, and while we're on the topic, Clenbuterol and Mirabegron don't seem to activate the beta-1 adrenergic receptors on the kidneys, shouldn't cause water retention, sodium retention, or any kind of modification of the renin-angiotensin-aldosterone system, even though there are some instances where Mirabegron causes water retention, as we saw in the commonly occurring side effect being angioedema, right? So again, proceed with caution, do some research, know what you're getting yourself into. All right, back to the head-on-head comparison. The off-label usage for Mirabegron, Clenbuterol, and salbutamol is fat loss and potentially anabolism, even though the anabolic benefits haven't been established. When it comes to Mirabegron, there's still clear performance-enhancing benefits when it comes to Mirabegron, but with Clenbuterol and salbutamol, that has been established. Clenbuterol activates the beta-2 adrenergic receptors, raises cyclic adenosine monophosphate and IGF-1 levels, is even classified as an anabolic agent by the World Anti-Doping Agency. And again, salbutamol has clear established anabolic benefits, activates the beta-2 adrenergic receptors, also raises cyclic adenosine monophosphate and IGF-1 levels. And it brings us to the common fat loss dosages. For Mirabegron, that's 50 milligrams per serving, 50 milligrams 1 hour pre-cardio, 50 milligrams 1 hour pre-workout, or around the same time on rest days, and 50 milligrams before bed, a total of 50 milligrams to 150 milligrams daily. With Clenbuterol, that's 20 micrograms 1 hour pre-cardio, 1 hour pre-workout, or around the same time on rest days, and 20 micrograms in between meals, for a total of 20 micrograms to 120 micrograms daily, even though most guys kind of top out at 80 micrograms daily. Don't take Clenbuterol before bed. Your resting heart rate will be way too high and you wouldn't be able to sleep. And from all of the research that I've done, Clenbuterol is potentially anabolic from 40 micrograms daily onward. So you don't have to go to 80 micrograms daily to get an anabolic benefit. At 40 micrograms daily, 20 micrograms before fasted cardio, and perhaps again 20 micrograms before the workout later in the day, you might already start to experience anabolic benefits. Salbutamol, when taken orally, 2 milligrams 1 hour pre-cardio, 2 milligrams 1 hour pre-workout, or around the same time on rest days, 2 milligrams between meals, a total of 2 milligrams to 12 milligrams daily, even though most guys top out at 6 to 8 milligrams salbutamol when taken orally daily. And intramuscularly, again, not clinically recommended, but also pleasurable, also fun when taken in injectable pre-workout super shredder anabolic anonymous formulations, 1 milligram bilaterally, 30 minutes to 1 hour pre-workout. Once you train like that, you can train without it, unfortunately. And again, salbutamol, from all of the research that I've done, is potentially anabolic from 4 milligrams daily onwards, so you don't have to take a lot of salbutamol to get an anabolic benefit or spill over into the beta-1 adrenergic receptors. 4 milligrams already has anabolic potential. Now, I know what you're going to ask me, which one is more potent, and can I stack Mirabegron with Clenbuterol or Mirabegron with salbutamol? And the short answer is yes. To all of that, Mirabegron seems to be more potent for fat loss because it's more tolerable regarding the side effects, and thus you can ramp the dosage upwards more than you would otherwise do with Clen or salbutamol. That being said, I was also using 10 IU's growth hormone per day, 3 milligrams ribosine per day, up to 600 micrograms SLU PP332 per day, and that has an overlapping effect on the fat loss results that I got from the Mirabegron. When I took the Mirabegron out, I didn't notice any significant change in water retention. Obviously, ribosine and growth hormone at these high overdosages potentiate a good amount of water retention, but over time, as I got leaner, the water retention came down. I didn't notice a change in overall water retention when switching from Mirabegron to 80 micrograms Clenbuterol per day, because I wanted to see what the differences were in overall fat loss. So I stopped the Mirabegron at 150 milligrams per day. I switched to 80 micrograms Clenbuterol per day, 20 micrograms pre-cardio, pre-workout around the same time on rest days, and 2 servings over the day in between meals to see if that had a comparable effect, which it did. The only difference is that I started getting a little bit clen cramps, and my resting heart rate and my heart rate during the workout shot up significantly. But it did also increase my exercise capacity slightly, right? So these are different compounds, different effects, but at an effective dose of 150 milligrams Mirabegron daily versus 80 micrograms Clenbuterol per day, I would say that the fat loss benefits are almost identical, while the side effects with Mirabegron are minimal. And then, of course, since you guys know that I'm crazy and I love to experiment, I went from 80 micrograms Clenbuterol daily to 12 milligrams oral salbutamol daily, 4 milligrams pre-workout, 4 milligrams pre-cardio, and another serving before bed, because on salbutamol, I can sleep no problem. Fat loss exactly identical over the course of a week. 150 milligrams Mirabegron versus 80 micrograms Clenbuterol versus 12 milligrams salbutamol. Fat loss pretty much identical alongside the growth hormone, the ribosine, the cardarine, and the SLU PP332 and whatever else that I'm doing, right? So I would say that the fat loss at these dosages for me is pretty much identical. Water retention is pretty much identical. On Clenbuterol, I got cramps and my heart rate was crazy. And on salbutamol and Mirabegron, my heart rate was manageable, right? So these two are more manageable when it comes to side effects, and Clenbuterol, well, that's basically hell. Then, for a few days, I dropped the salbutamol dose in half from 12 milligrams per day to 6 milligrams per day, 2 milligrams before fasted cardio, 2 milligrams before the workout, and 2 milligrams before bed, alongside 50 milligrams Mirabegron per serving. So every serving had 2 milligrams salbutamol and 50 milligrams Mirabegron 3 times per day. That enhanced fat loss quite a bit. Yeah, I did it for 3 days and it was noticeable. That was almost a week's worth of fat loss. Next, instead of the salbutamol, I switched that to 20 micrograms Clenbuterol, but I only did 2 servings of Clenbuterol, 20 micrograms before the workout and 20 micrograms before fasted cardio. No micrograms before bed because I can't sleep, even on 20 micrograms Clenbuterol before bed. Fat loss was also dramatic. Yeah, but the side effects were also dramatic. So if I were to go with the combination between a beta-2 adrenergic receptor agonist and a beta-3 adrenergic receptor agonist, I would go with salbutamol and Mirabegron over Clenbuterol and Mirabegron, simply because the resting heart rate changes are such a significant difference. Now, could I offset this increase in resting heart rate and heart rate during the workout of Clenbuterol in combination with Mirabegron with a beta blocker like nebivolol or propranolol? Potentially. Potentially, right? By blocking the beta-1 receptors on the heart rate would obviously come down. As a result of this, you might slow down fat loss to a certain extent, because some of the fat loss is actually coming from an elevated resting heart rate and an elevated heart rate during the workout beyond normal. But I would rather go with less medications and less side effects, in which case I would go with a combination of salbutamol with Mirabegron over a combination of nebivolol, Mirabegron, and Clenbuterol. But technically, on paper, based on the human biology, that would work also. Now, just like the beta-2 adrenergic receptors, the beta-3 adrenergic receptors can also downregulate and desensitize. So don't overdo the Clenbuterol and the Mirabegron together, because that's a lot of beta-2 and beta-3 adrenergic receptor activation, even if you block the beta-1 receptors with something like propranolol or nebivolol. We already know that beta-2 adrenergic receptor downregulation and desensitization starts to occur beyond 80 micrograms Clenbuterol daily onwards, in which case it also starts to spill over into the beta-3 adrenergic receptors, enhancing fat loss, but lowering and reducing overall resting heart rate. So that's a little bit of a benefit. Then, of course, you would resort to 1 milligram quetiapine or Benadryl before bed to open up and increase the sensitivity of the beta-2 adrenergic receptors, making clenbuterol a lot more effective, requiring you to half the dose going forward. But with Mirabegron, I can't find any clear scientific evidence regarding beta-3 adrenergic receptor desensitization or downregulation. Since the medical dosages of Mirabegron are between 25 milligrams to 50 milligrams daily for months to years onwards, I would assume that at these dosages, there's no risk for beta-3 adrenergic receptor downregulation or desensitization. It's kind of unclear what happens at 100 milligrams to 150 milligrams daily. They do specifically mention in the medical inserts that at 200 milligrams Mirabegron daily, there's adrenergic spillover into the beta-1 receptors, increasing the risk for an elevated resting heart rate. But this, I believe, has been established in vitro studies, not in human subjects. The medical insert is linked down below in case you're interested. Now, what downregulates the beta-3 adrenergic receptors or desensitizes them? In which conditions might that occur? With chronic stimulation and agonist exposure, including Mirabegron at higher dosages potentially. Inhibited arrestin binding, which is induced by phosphorylation of the G protein coupled receptor kinases, which promotes the binding of arrestin proteins after Mirabegron or other agonists attached to the beta-3 adrenergic receptors. And this arrestin blocks further signaling and promotes receptor internalization, reducing the amount of available beta-3 adrenergic receptors on the cell surface of adipose tissue. Obesity downregulates the beta-3 adrenergic receptors in adipose tissue. Insulin resistance states blunted beta-3 adrenergic receptor signaling in adipose tissue. And the chronic hyperinsulinemia and elevated circulating free-form fatty acids also leads to receptor desensitization. Systemic inflammation, pro-inflammatory cytokines like tumor necrosis factor alpha, heart failure, and adrenergic overdrive. Age-related decline of beta-3 adrenergic receptor expression and sensitivity. So don't take Mirabegron when you're too old, right? It will stop working. Genetic ADRB3 gene polymorphisms, which encodes the beta-3 adrenergic receptors, may reduce receptor sensitivity or expression. The TRP64ARG polymorphism is associated with reduced receptor function and is linked to obesity and insulin resistance. And then the overuse of beta blockers like nebivolol, which also activates the beta-3 adrenergic receptors. A combination of high-dose nebivolol beyond 10 milligrams daily and beyond 200 milligrams of Mirabegron daily, probably not a good idea. And it brings us to the dosing protocol. Hell yes. For men, I would say that the sustainable and tolerable dose is anywhere between 50 milligrams 1 hour pre-cardio, 50 milligrams 1 hour pre-workouts, or around the same time on rest days, and 50 milligrams before bed. A total of 50 milligrams to 150 milligrams daily, and the deleterious dose will be over 150 milligrams daily based on the scientific evidence regarding spillover and the potential for increased side effects. I haven't gone up to 200 milligrams daily because I got all the fat loss benefits on 150 milligrams daily. If you're going to be crazy enough to combine a beta-2 with a beta-3 adrenergic receptor agonist medication, and again, I don't generally recommend this, but I know people out there are going to try it, so I might as well give you some fucking guidelines. If you're going to go with Mirabegron and Clenbuterol, with Mirabegron, you would stick to the sustainable and tolerable dose between 50 to 150 milligrams daily, in combination with Clenbuterol, 20 micrograms 1 hour pre-cardio and 20 micrograms pre-workouts or around the same time on rest day, a total of 20 micrograms to 40 micrograms daily alongside the Mirabegron. And if you decide to go with Salbutamol, with oral administration, that would be 2 milligrams 1 hour pre-cardio. With intramuscular administrations, I would limit it to 1 milligram bilaterally, 30 minutes pre-workouts, or 2 milligrams orally 1 hour pre-workouts, or around the same time on rest days, and maybe a third serving of 2 milligrams before bed, taken orally. So that's a total of 2 milligrams to 6 milligrams daily. Alongside the Mirabegron, but again, do this at your own risk. I don't recommend this. Just because I'm crazy doesn't mean you have to be crazy. But I will say that the fat loss is substantially enhanced when combining Mirabegron with either Clenbuterol or Salbutamol at lower dosages. Again, lower dosages. And when it comes to women, since I haven't talked to any women out there who've actually tried Mirabegron, and feel free to post your anecdotal experience down below in the comments section. If you're a woman experienced with Mirabegron, feel free to correct me. But for now, I preemptively halved the dosages. So the sustainable and tolerable dose for women is 25 milligrams 1 hour pre-cardio, 25 milligrams 1 hour pre-workout, or around the same time on rest days, and maybe 25 milligrams before bed. A total of 25 milligrams to 75 milligrams daily. The deleterious dose would be over 75 milligrams daily. And if you would want to combine that with a beta-2 adrenergic receptor, like Clenbuterol or Salbutamol, that would be 10 micrograms Clenbuterol 1 hour pre-cardio and 10 micrograms 1 hour pre-workout. A total of 10 micrograms to 20 micrograms daily. I know it's a very low dose, and women can probably tolerate a lot more Clenbuterol than men do. But, well, no anecdotal experience means the dosages are going to be preemptively low. And with Salbutamol orally, that's 1 milligram, 1 hour pre-cardio, 1 milligram if you want to inject that 30 minutes pre-workouts. But if you take it orally, 1 milligram, 1 hour pre-workout orally, and maybe 1 milligrams orally before bed, a total of 1 milligram to 3 milligrams daily. Combine at your own risk. I don't recommend this, but if you're crazy enough to do this and you have experience with this, let us know down below. We would all love to hear about it. Feel free to start low and build your way up because it's a reasonably new compound and not so many men or women in the fitness community have experience with Mirabegron. Unlike Clenbuterol and Salbutamol, Mirabegron is not included in the World Anti-Doping Agency prohibited list of 2024, but the 2025 version is going to drop reasonably soon, so let's see what happens. For now, Mirabegron might be a suitable fat loss aid and fat burner for people undergoing physique sports that are subject to drug testing, and otherwise you stick with a detection time of, let's say, 10 to 12 days, the documented detection time based on a single administration for Clenbuterol, or the reported detection time of up to 21 days. And with Salbutamol, well, they have some exceptions here in the prohibited list of 2024. Inhaled Salbutamol, you can take a maximum of 1600 micrograms over a 24-hour period in divided dosages not exceeding 600 micrograms every 8 hours, starting from any dose. So you might be able to circumvent the Salbutamol usage or just stick to Mirabegron, which again is not included in the prohibited list, but still offers plenty of fat burning opportunities and benefits. And before we close off this video, there's one more study I want to highlight, even though it's not a full publication. It's a review paper discussing all of the previous benefits regarding Mirabegron in its potential to raise exercise capacity and if it should be marked as a doping agent. This study performed by Lice et al. Titled Effects of Mirabegron on the Body's Exercise Capacity, a Review. Now, unfortunately, this study is not available. It's quite expensive to purchase, but luckily for us, in the graphical abstract, the researchers kind of aggregated and summarized all of the potential benefits regarding exercise capacity of Mirabegron, which is basically the same conclusion that I came to in the evidence-based unique characteristics. So here you see that Mirabegron reduces body mass and adipose tissue, increases overall and resting energy expenditure, raises HDL while lowering total cholesterol and triglyceride levels. Mirabegron increases insulin sensitivity and glucose tolerance, lowers insulin resistance and hemoglobin A1C levels, but also lowers glucose intake by brown adipose tissue, likely because brown adipose tissue is now shifting to fatty acid oxidation. And the researchers say that Mirabegron is reasonably safe on the cardiovascular system, but it does raise diastolic and systolic blood pressure while increasing heart rate as well. Let's wrap it up here. It looks very promising to me, whether you run Mirabegron solo or in combination with Clenbuterol or Salbutamol. Again, proceed at your own risk. Please do some additional research when it comes to the inhibition of the cytochrome P450 2D6 enzymes regarding potential drug overlap and inhibition of drug metabolism of other ancillaries that you might be taking. And again, if you're combining Mirabegron with fluvoxamine, inhibition of P450 enzymes galore, right? Both the 2D6 and the 3A4 enzymes. If you have anecdotal experience, let us know down below. Have you run Mirabegron in combination with Clenbuterol, Salbutamol, Nebivolol, etc.? What was your experience? How much fat loss did you get? Especially when stacking this with SLU-PP332, cardarine, telbasartan potentially, right? Carnitine, all of the fat loss aids that might be beneficial alongside Mirabegron. Let us know down below. It's a reasonably new compound that not so many people have experience with, I'll be throwing away my Clenbuterol and never touch that again, because Mirabegron, for me personally, in combination with Salbutamol at low and effective dosages, is far superior than any kind of fat loss that I got from Clenbuterol, because the side effects are so much more manageable. All right, I'll leave it here. Thank you guys so much for watching. You can find everything that I'm associated with down below in the YouTube description section. Follow me on Instagram, no more TikTok, but Instagram is still there, at Vigorous Steve. If you can't find anything particular that I discuss in these YouTube videos, just go over to my website, vigoroussteve.com. I'm always available for personalized advice through consultations or personalized advice by email. Do your blood work over at Merrick Health, whether you take Mirabegron or not, right? Blood work is always important. Make sure you do your blood work so you have fundamental insight into what's going on into your own body so you can make the appropriate adjustments. And if you don't know how to interpret your blood work results, I'm always available for consultations, or you can sign up with one of the patient care coordinators, healthcare providers over at Merrick Health who can help you interpret your blood work results. And if you want the best pre-workout alongside injectable albuterol, look no further than Gorilla Mind. Gorilla Mode Nitric is the shiznit, especially when combined with glycerol for mega super pumps. Vigorous crew, you guys know what to do. A fully maxed out Mirabegron frontal blaster for you guys, getting lean and mean, nice and large and in charge. There might be no anabolic benefits to Mirabegron, but whatever else I'm running, I'm certainly anabolic AF. All right, let's leave it here. Thank you guys so much for watching, and I'll see you in the next deep dive, dropping soon.